Hi, my name is Emily Greene and I'm a senior at Dartmouth College. I will be sharing with you some background about my research on secure sharing of wearable healthcare data. As this thesis is in the mHealth space, I wanted to give some background on what the term actually means. mHealth is the use of mobile computing technology in the healthcare space, which is becoming increasingly common and important as technological innovation penetrates the healthcare industry and improves services currently rendered. My thesis in particular focuses on wearable healthcare devices, which facilitate the collection of health data outside of a doctor's office or a researcher's lab. Previous studies have shown that those that produce data, such as the patients, want to be able to control who gets access to what data. Keeping this data secure is paramount, as unauthorized access to healthcare data violates the Health Insurance Portability and Accountability Act, or HIPAA. Therefore, the motivation of this project centers around how data owners can specify what access they want to grant to data consumers and how these access control decisions can be enforced in a secure way. Let's look at an example to get more clarity. For example, take Alice. Alice is a pretty serious athlete who uses her wearable devices to help her train and stay healthy. She has two devices, the amulet and a Brighton rider, that each collect different data. The amulet collects stress monitoring data, heart rate, TheraBand usage, and activity level, whereas the Brighton rider collects cycling data, such as speed, altitude, distance, GPS, duration, and power. She wants to share subsets of this data with different people, such as her coach, doctor, psychiatrist, physical therapist, teammates, and friends. Alice needs a flexible and granular access control approach in order to satisfy these diverse needs. Our system combines two different types of access control in order to provide one complete solution to the problem. The first is access control by data type. This means providing or restricting access based on different attributes of the data. For example, access is given to heart rate data taken when the person was working out, but not otherwise. Those attributes could be heart rate and exercise. Once the policy is set, it is cryptographically enforced using attribute-based encryption. The attribute-based encryption we'll be using, called key policy attribute-based encryption, works by tagging data with different attributes and issuing each data consumer a key with a specific policy across those attributes. So, as you can see from the graphic, the data consumer depicted with the blue dots has a key that can unlock only data with step count and heart rate attributes. These allow for the flexibility of overlapping policies, like the blue and pink overlap, while still providing granular restrictions. The second type of access control in our system is temporal access control. This means providing or restricting access based on the time that the data was produced. For example, only providing this week's heart rate data, not last week's. The temporal component is one part that makes our system particularly innovative, as we use the second type of cryptographic system, called hash chains, as database indices, to provide this time-based control. Randomly seeded hash chains, which are one way and difficult to guess, allow indices into the database to be secret, so a consumer can only get access to that temporal segment of the data stream if they know the seed or the hash for that segment. In the timeline graphic, you can see that there are three different consumers represented by three different colors that are each granted access for only a specific period of time, even though their policies overlap. So, how do we actually apply this access control in a system? Well, our system has three components: the data owner's smartphone, the cloud database, and the consumer portal. The data owner's smartphone is where most of the computation occurs. The smartphone compiles data from different wearable devices, allows the owner to set access control policies, encrypts the data based on these policies, and adds the data to the cloud database. The database stores data from multiple data owners, and the hash chain indexing scheme keeps this data anonymous. The consumer portal can then use this indexing scheme to query data from the database without the database knowing what type of data was requested, decrypt the data, and display the data to a consumer, such as a doctor or researcher. Overall, my thesis is going to contribute three things to the mHealth community. First, access control and wearable data instead of electronic medical records, or EMRs. Most of the current literature focuses solely on EMRs, but wearable healthcare data presents unique challenges as it is in the form of continuous data streams. Therefore, fine-grained access control does not just consist of whether or not a party should have access to that data stream, but to what portion of that data stream. There is a temporal component to access control that must also be considered, especially at the frequency and rate that wearable data is produced. Therefore, we also handle temporal access control, which allows our system to be more granular and facilitates revocation. Finally, our system is a departure from the siloing of wearable data. In the current wearable space, each device has its own vertical ecosystem, which can be inefficient for people with multiple devices, and which misses opportunities for aggregation of data across devices to provide a more complete picture of the person's health. This allows owners to provide access control policies across all of their devices. I'm very excited to complete this research over the coming months. Thank you for considering me for the Collegiate Award.